Did you know that a book exists written by Ethan Russo, MD, Melanie Dreyer, PhD, and Mary Lynn Mathry, RN, Masters of Nursing, entitled Women, Cannabis, Medicine, Science, and Sociology? Well, this book was banned from being printed and sold in the United States until recently. I had a friend who was pregnant in 2012, and she had horrible nausea and vomiting. She was told that she could take Zofran, but the clinical side effects are pretty extreme, such as cardiac septal defect and other malformations with early use in pregnancy. And she really was not okay with that. So she decided to do some research, and she found that book. But when she found it, she found out that it was $500 to buy it. And that wasn't very economical, so she opted not to. But I, in this adventure, looked for it again, and I found it for $144. So I did opt to buy it, and it's pretty awesome. I've read through the first, pretty good first section of it, and it's very informative, and this is what I have found from that book. It was written by Ethan Russo. Again, I mentioned that. He was a board-certified neurologist and a psychopharmacologist. And Melanie Dreyer, who again was a PhD, she served as a charter member of the National Institute for Nursing Research. She also did quite a few studies in Jamaica, which proved that most of the children that were exposed to cannabis were at no different level at ages 1, 3, and 5 based on children who were not exposed. Mary Lynn Mathers, who is a Master's of Nursing, she is the president and co-founder of Patients Out of Time, which is for patients who are dying actively from different ailments. So in my research, I found 3 reasons to consider medical marijuana, or I guess now in this state, recreational marijuana, to alleviate most medical ailments. Marijuana has been a natural, safe, and effective way to alleviate certain medical conditions, especially with the neonate during feeding delay. It has been found that it was, called medical marijuana even before, I'm going to keep going. It was used for dysmenorrhea, dysuria, hyperemesis gravidarum, and menopause symptoms. As I mentioned in my first speech, it attaches to the CB1 receptor of the central nervous system, and it is expressed by the immune system for the CB2 receptor. But there is more to this story. In a woman's breast milk, they found what is called 2-AG, or endocannabinoid arachidoglycerol, which is an engineous ligand for the CB2 receptor. What they found is that if you block this receptor, or the CB1 or the CB2, that the neonate tends to show failure to thrive, which means that they don't eat and they don't gain weight, and so they run the risk of dying. If any of these receptors are blocked, like I mentioned, they could not gain weight. It has been suggested by the medical community that they start utilizing the cannabinoid receptor to decrease these outcomes. It encourages the suckling in the neonate, and it also decreases the failure to thrive. There have been several studies conducted on the endocannabinoid receptor, and what they found is that when they injected the antagonist of the endocannabinoid, messed that up again, they did not affect the mother. It's fine, keep going. But when they injected it into the pups within 24 hours, most, if not all, of those mice puppies died. So, and it was dependent It was a dose dependent on anywhere from 5 milligrams to 20 milligrams per kiloweight, but it had to be given within the first 24 hours. So, I also found out how they were treating hyperemesis gravitorium, or really debilitating nausea and vomiting in the pregnant woman. It is categorized by severe nausea and vomiting, malnutrition, and significant weight loss during pregnancy. In most cultures, it's really not a big deal what the woman eats, as long as the woman eats. But when that woman cannot eat, as such when she has hyperemesis gravitorium, the will to eat is completely gone because she can't keep down any type of food or liquid. These signs and symptoms have been likened to what cancer patients or AIDS patients experience, but we're basically told that we just have to kind of suffer through it. The signs and symptoms could also include, and I think I forgot to mention this, significant weight loss. Per Dr. Metz, who is actually a local OBGYN, there has been an increase in reports of women using marijuana, not only in the reproductive woman, but in the woman that is pregnant, for use of nausea and vomiting. But with education, she has been shown to decrease use. So that brings me to my final point of how does the public perceive the woman that uses marijuana in the public eye. And so I also have a graph too that I'm going to turn around now just so you guys can kind of look at, and we will get to that. Susan Boyd wrote a book called Women and Illicit Drug Use, Transcending the Myths. And she said that of all the illicit drugs used by women, marijuana is the most benign. And she also said that those who choose also choose to not want to choose other RX modes for ailments. In my chart here, in the past 5 years, 29 states have legalized the use of medical marijuana, which shows that the use of medical marijuana and the stigma that has been associated with it has been greatly reduced, especially when you consider here from 1996 to 2013 that only 22 states chose to legalize medical marijuana. Women who choose illicit drugs are labeled deviant mothers and are linked to behaviors such as immaturity. They're called unfit mothers, and in the past they were portrayed as women who failed their role as a mother. Women who choose to use marijuana as mothers are still believed to provide a chaotic, dysfunctional, and often abusive home. But this is most often not the case. In most cases, the child is brought up in a loving, caring, safe home and environment. Most children and child abuse laws are used against poor and women of color, as evidenced by the fact that mainly poor and women of color are subjected to toxicology urinalysis upon arrival to hospitals to deliver their babies. It appears that most of all child abuse allegations against pregnant and nursing mothers, when it pertains to the use of marijuana, are racially biased. Per Dr. Metz, again an OBGYN in Denver, Colorado, states that marijuana use alone is not associated with adverse prenatal effects, but marijuana use with cigarettes did raise concerns for addictive and synergistic effects. To conclude my presentation, we've discussed how marijuana can be beneficial as an all-natural, safe, and effective way to treat certain medical conditions, especially in the neonate when having difficulty feeding, and we've discussed how utilizing medical marijuana may help reduce the occurrences and the signs and symptoms of hyperemesis gravidarum in pregnant women. And we have also explored how medical marijuana use during pregnancy continues to have a strong stigma in most of the United States. My intentions for this speech were to educate you on the benefits of marijuana and what is still considered an unorthodox way, even for our progressive and mainstream environment. I hope that the next time you feel the urge to chastise someone for partaking in their preference, remember that these chemicals are already in all of us. That's it.